Dr. Manning will be doing a podcast today. This is going to talk about vein stuff. I have the men's clinic, but I also have Mississippi Vein. That was actually my first clinic that I started, back in 2008. The major thing that we work on there, we work on varicose veins. That's probably the most common thing that we work on. We're going to talk about that today. We fix spider veins and we fix venous ulcerations as well. But today we're going to be talking about varicose vein disease. These are the big ropey veins that you see on the skin surface in the legs. Typically, this is an inherited problem. Almost every patient that I see in Mississippi Vein has a first degree or second degree relative that also had varicose veins. And there are some specific leg veins in your legs that have one-way valves in them that help the blood go from lower extremity back up to your heart. They pass by these little valves, they close, move to the next one, they close, and the blood kind of inchworms its way back up to the heart. And what you inherit is the tendency for these particular valves and these particular veins to fail. And when they do that, you begin stacking blood in your leg. The most important thing to understand is the varicose veins at the surface are not your problem. That's a manifestation of your problem. Your problem exists in some leg veins deeper in your leg. And they have these little one-way valves in them. And blood is going, from the lower extremity back to the heart this way. When these valves fail, you start getting blood going the wrong way. And then this vein dilates, and then its branches, its normal branches, begin to dilate. Those are the varicose veins that you see at the surface. So varicose veins aren't your problem. They're a manifestation of your problem. Your problem lives in this vein further down in your leg. We identify that with an ultrasound exam. So you come in, I have a registered vascular technician that does my ultrasound exams for me, and we look at these particular leg veins to see if you see this reflux, this blood moving in the wrong direction. And if you do, then you're a candidate for the operation that we do. The way it works is we put a laser fiber that's long and skinny. It's kind of like a piece of fishing line, but it's a little stiffer than that. And we put it in under ultrasound guidance, and the laser fiber goes inside the sick vein here. And it's hooked to a computer that slowly pulls this back as the laser's firing. So it helps to conceptualize welding. It's like we're welding together this sick vein. You can't fix it. You can't fix the valves. People have tried to do that, but they're just like paper. They're too flexible and too flimsy to fix. So we just remove it from circulation. In the old days, you had to go in for a vein stripping, bigger deal. They went in and surgically stripped that vein out. Now we can do it under ultrasound guidance with a laser fiber, put it all the way up, and the machine slowly pulls it back as it's firing, and we eliminate this vein from circulation. And everybody says, well, don't I need that vein? The Lord gives us about 30 to 40 miles of vein per leg. When we run this laser, we're running on about 3 feet of vein. So, I don't care how bad your varicose veins are. As a general rule, 99, probably 0.9% of your leg vein is fine. You've just inherited a defect in a very, very small and specific portion of your lower extremity venous disease that's predisposing you to varicose vein formation at the skin surface. So the laser runs through here, ablates this vein, and we're able to leave this in your leg. It's deep enough in your leg that you'll never know it. Your body's going to resorb the carcass of the vein. Then once we do that, through little micro incisions that are so tiny at the skin surface, they leave little to no mark at all. I don't have to sew these things. I just put a steri-strip on them. But we remove the varicose veins. Some people out there will tell you that, we're just going to run the laser and the varicose veins will go away. Not true. If you want the level of aesthetic result that we give, if you want your leg to look like it did when you were 15 years old, then those varicose veins have to come out. And at Mississippi Vein, we pride ourselves on giving our patients just incredible results. Not only a functional result, the functional result comes from the laser. That's going to fix your symptoms. And those symptoms are leg pain, cramps, restless leg syndrome. You can have recurrent cellulitis, which is an infection in your lower legs and your skin where your leg turns real red. And then, if you have disease in this underlying vein long enough, you can actually start pushing red blood cells out into your skin. And they'll die and they leave the iron behind. We've all seen people with brown on their legs. and on their lower legs, and that's coming from severe venous disease. Those particular patients are very, very important to fix because those are the ones that can go on and form a venous ulcer, which is a non-healing sore above either the ankle on the outside of your leg or on the medial side of your leg. So those patients are really important to fix. But we sedate all of our patients for this procedure. Both myself and my partner used to be anesthesiologists. I started Mississippi Vein back in 2008. That's all I've been doing since then. But I like all my patients to know that both myself and my partner used to be anesthesiologists because I want you to know you're safe about being sedated at Mississippi Vein. And I want you to know that we're not afraid to sedate you either. We want you to have an excellent treatment experience because you're going to forget what I say, you're going to forget what I do, but you're not going to forget how we make you feel. That's what you're going to remember. And, a lot of people have seen me on commercials, on TV. The best advertisement I got by far is my patients and the results that they've gotten. So we take that very, very seriously. So not just a good result at the skin surface, but a good treatment result too. I want my patients to remember, I want us to be friends on the other side of me fixing their legs. So no one's going to be hurt here. It's a safe procedure to do. Everybody asks me about the chance of a blood clot or an infection or something like that. That is incredibly rare. We have done over 30,000 of these particular procedures. And, if I've seen 20 or 30 blood clots in all those years, I would be surprised. No one has ever died at Mississippi Vein. Everybody laughs when I say that, but I think that's important to know. Most of the time when I've seen a clot, it's been in people that have had clots before, and they weren't life-threatening clots. We were able to fix them fine, but that is a very, very rare occurrence. 99.99% of people go through this procedure and do very well. After it's over, the patient's legs are wrapped with an ACE wrap, and they leave that on overnight. And then in the morning when they wake up, they take all that off, take a shower, and put a compression hose on that they'll wear for 1 week on each leg. Typically, we do one leg 1 week and the other leg a week later. Patients then come to see us in 2 weeks after we're done, and we evaluate everything, make sure everything looks like it should. And then the last time we see our patients is 3 months out, because I want everybody to live with our repair for 3 months and let me look at it one last time to make sure our wells, in my example, the vein that we ablated, that everything is tight and looks like it should. But the most important thing we're doing is we're taking your after picture. All of the patients that come to Mississippi Vein get their before and after pictures to take home with them, because I think if you're doing good work, you're going to give the patients the photos. And we do excellent work at Mississippi Vein, take great pride in it. So if you have varicose vein disease, call, make an appointment. We'll get you in, get you evaluated, and get your legs back in top shape.